In our next module, we'll cover the topic of cementum. As in the previous module on epithelium, I have posted in the Files section of Canvas a handout to which you can use to help follow along in this presentation. Simply put, cementum is a mineralized tissue that covers the root dentin. Cementum serves many different functions. It attaches the principal periodontal ligament fibers to the root and contributes to the process of repair after damage to the root surface. It may also serve to adjust the position of the tooth to new positions as things change on the tooth throughout life. Cementum formation can be divided into two stages, a pre-functional stage and a functional development stage. The pre-functional portion of the cementum is formed during root development. The functional development begins when the tooth is about to reach the occlusal level and continues throughout life. Additional cementum is laid down throughout life, but it's important to remember that the mineral content does not change significantly. Cementoprogenitor cells originally arise from the dental follicle. These cells in turn differentiate along the newly deposited but not yet mineralized radicular mantle dentin into cementoblasts. These cementoblasts then form cemental collagen, which is primarily type 1 and type 3 collagen. Once the cementum matrix is established and the dentinal matrix is covered with collagen fibrils, then the mineralization front in dentin can reach the dentinocemental junction. Cementum mineralization begins in the pre-cementum, first between and then secondarily within the collagen fibrils. Cementum is a unique tissue in the fact that even though it is mineralized, it is avascular with no innervation and no lymphatic drainage. As we stated before, it is primarily type 1 and 3 collagen within a mineralized matrix. The mineral content is predominantly hydroxylapatite at about a 65% volume ratio. It is also unique in that it does not undergo physiologic resorption or remodeling like bone does, but is characterized by continuing deposition throughout life. There are two main types of cementum, primary and secondary. Primary cementum is also referred to as acellular cementum, whereas secondary cementum is referred to as cellular cementum. Both consist of a calcified intrafibrillar matrix and collagen fibrils. There are two main sources of collagen fibers in cementum. Extrinsic fibers, also known as Sharpie's fibers, which are embedded portions of the principal fibers of the periodontal ligament and are formed by fibroblasts. Intrinsic fibers are fibers that belong to the cementum matrix and are produced by cementoblasts. Again, cementum is biochemically and physically very similar to bone. Now, cementum doesn't always extend to the cementoenamel junction. Most often, as seen on the right, it overlaps the enamel. This occurs about 60 to 65% of the time. 30% of the time, it ends right at the junction of the enamel. However, 5 to 10% of the time, there is a gap, as you can see here. This gap is formed because of the cementum not totally reaching the enamel ends. This sometimes explains why patients report brief pain on exposure to cool air and water. Now, it can get confusing because cementum can be classified in many different ways, but this is a very simple way of thinking about it. We can classify cementum based on location, by its cellularity, by the presence of collagen fibrils in the matrix, or by the origin of the matrix fibers. Let's first define some of these terms. Radicular cementum is cementum that is found on the root surface. Coronal cementum is that cementum that forms on the enamel covering the crown, much like we saw in the previous slide. If we define things by cellularity, we have cellular cementum, which is cementum that contains cementocytes and lacunae within the cementum matrix. Acellular cementum, on the other hand, is cementum without any cells within its matrix. If we define cementum based on the presence of collagen fibers, we have fibrillar cementum, which is cementum with a matrix that contains well-defined fibrils of collagen, or afibrillar cementum, in which we have cementum that is devoid of detectable collagen fibrils. Instead, the matrix tends to have a fine granular consistency. If we wish to define it by the origin of the matrix fibers, we have three different terms we can use. Extrinsic fiber cementum, which is cementum that contains extrinsic fibers, also known as the Sharpie's fibers, that are continuous with the periodontal ligament. Since the fibers were originally produced by a periodontal ligament fibroblast, they are considered extrinsic to the cementum, thus the name. These fibers are oriented more or less perpendicular to the cementum surface and play a major role in tooth anchorage. Intrinsic fiber cementum, on the other hand, is cementum that contains primarily intrinsic fibers, those fibers that are produced by cementoblasts. These are oriented more or less parallel to the cementum surface. This form of cementum is located predominantly at sites undergoing repair or areas following surface resorption. This type of cementum, the intrinsic fiber cementum, plays no role in tooth anchorage. Mixed fiber cementum, by the name you've probably guessed, is a mixture of both extrinsic and intrinsic fiber cementum. More commonly, cementum is defined based on its cellularity. We have acellular afibrillar cementum that is found mainly at the cervical portion of the enamel, and acellular extrinsic fiber cementum, which is found in the coronal and middle portions of the root and contains many bundles of Sharpie's fibers. This type of cementum is an important part of the attachment apparatus and connects the tooth with the alveolar bone proper. In our photomicrograph on the right, you can see we have a dentin surface, the enamel surface, and then a periodontal ligament. AAC corresponds to the acellular afibrillar cementum, and you can see it's right at that enamel junction. AEFC is the acellular extrinsic fiber cementum that is found in the cervical and middle third of the root. If we have cementum where we are seeing cells present, we can define it based on two different definitions. We can have cellular mixed stratified cementum, which occurs in the apical third of roots and within furcations. It contains both extrinsic and intrinsic fibers as well as cementocytes. Cellular intrinsic fiber cementum, on the other hand, is found mainly in resorption lacunae, and it contains intrinsic fibers and cementocytes. If you look to the right in the left panel, this unstained, undecalcified ground section that is viewed under polarized light demonstrates the structure of cellular mixed stratified cementum. You can see it consists of alternating layers of acellular as well as cellular cementum. The acellular is extrinsic fiber cementum, while the cellular is intrinsic fiber cementum. On the right, we have another unstained, undecalcified ground section viewed under polarized light. This is cellular mixed stratified cementum. The black cells within the cementum are actually cementocytes that reside within lacunae inside the cellular intrinsic fiber cementum. Cellular intrinsic fiber cementum, remember again, is found within the cellular mixed stratified cementum. The arrow points to where we have a cementocyte communicating through a network of cytoplasmic processes that run through canaliculi in the cementum. That was a lot. Now let's look at something that's a little bit simpler. Radiographically, the normal appearance of the attachment mechanism of cementum, alveolar bone, and periodontal ligament appear as you see here. However, there are times when there are changes that can occur throughout life where we have a thickening of the cementum. This prominent thickening is termed hypercementosis and is largely an age-related phenomenon, and it may be localized to one tooth or affect the entire dentition. As a result of considerable variation in the thickness of cementum among different teeth in the same person, and also among different persons, distinguishing between hypercementosis and the physiologic thickening of cementum is sometimes difficult. Radiographically, it appears commonly as you see here, where we have a radiolucent shadow of the periodontal ligament and the radiopaque lamina dura, always seen on the outer border of an area of hypercementosis, enveloping it as you would see within normal cementum. Again, here is your lamina dura, and here is your periodontal ligament. On the other hand, from a diagnostic standpoint, periapical cemental dysplasia, condensing osteitis, and focal periapical osteopetrosis may be differentiated from hypercementosis because all of these entities are located outside of the shadow of the periodontal ligament and the lamina dura. Now, the cause of hypercementosis is not fully understood. However, several local and systemic factors may be the cause. This now concludes our module on cementum.